You know that feeling, right? When you're finally leaving the hospital.
Oh, yeah. Huge relief.
Definitely relief. But sometimes there's also this undercurrent of anxiety, maybe feeling a bit vulnerable. You're juggling meds, watching symptoms, just trying to get back on your feet.
It's a really sensitive time. That transition period right after discharge.
Yeah.
It's just as crucial for recovery, really, maybe even more so for preventing problems, than the hospital stay itself.
Absolutely. We've talked before about AI inside the hospital, optimizing surgery, sorting out nurse schedules, that kind of thing.
Mm-hmm.
But today we're looking after discharge. How can AI build a stronger, a safer bridge home for patients, making sure that care continues properly?
Because, let's be honest, the sources we looked at make it clear the old way, the traditional way, it often struggles.
How so?
Well, it tends to rely on, maybe a phone call here or there, an occasional home visit if you're lucky.
Yeah.
It's very reactive.
Reactive meaning you wait for a problem to happen.
Exactly.
Yeah.
Problems often only get noticed once they've already gotten pretty serious. Patients can feel really isolated, wondering, is this normal? Or who do I even call?
And critical changes might get missed entirely.
Which often leads right back to the hospital.
Yeah.
And that's costly, stressful, just awful for everyone involved.
Yeah.
And healthcare staff, they're stretched so thin, manually keeping close tabs on everyone who's just gone home. It's practically impossible.
Like that example in Sources, Mrs. Rodriguez. Struggling with complex instructions, her daughter worried sick after a previous readmission.
Yeah, that story really highlights the gap. The current system just isn't set up to provide that continuous, personalized support effectively for everyone.
Okay, so if the traditional system is stretched and reactive, how does AI actually step in? How does it, fill that gap?
Right, so AI brings a different approach. It shifts things from reactive to proactive and personalized.
Yeah.
And preventative.
Proactive, okay.
Yeah, the sources kind of paint AI as this dedicated, tireless helper, a vigilant guardian, always analyzing data, spotting subtle changes, ready to answer questions or give support right when it's needed.
Like weaving a safety net almost?
That's a great way to put it. A safety net.
So let's dig into the specifics. What are the concrete ways AI does this, according to the sources?
Okay, well, one of the big ones our sources highlight is readmission risk stratification.
Predicting who's likely to bounce back to the hospital.
Exactly. Traditionally, that was often a doctor, manually digging through the patient's electronic health record, the EHR. It takes ages, and it's pretty subjective.
Right, and AI improves on that.
Massively.
Yeah.
And faster. You train an AI model on tons of historical patient data from EHRs.
Okay.
And it can look at hundreds of things at once. Diagnoses, lab results, medications, demographics, even social factors like living situation, if that data is in there, social determinants of health.
It processes all of that.
Yeah, it sees patterns humans might miss. And based on all that, it identifies patients who are at high risk of coming back much more accurately.
Which means the hospital team can focus their efforts.
Precisely. The AI spits out a risk score, flags the high-risk patients, so before they even leave, the team knows who needs extra support.
Makes sense.
Like the example of Dr. Sharma. She gets an alert. High readmission risk. Boom. That prompts her immediately to bring in a social worker, a pharmacist, to tackle those specific risk factors right there during discharge planning.
Yeah.
It's about targeted, early intervention driven by data.
Okay, identifying risk is huge. What about those discharge papers you mentioned, the confusing ones?
Oh, yeah. That's another major pain point. Which brings us to automated discharge summary generation.
Right.
Those instructions, often packed with medical jargon, super hard for patients, for families to really grasp. And if you don't understand, you might not follow the plan.
Leading to problems, maybe another readmission.
Exactly. It's a huge driver of complications.
Yeah.
So AI can help here by using natural language processing, NLP.
NLP. To do what?
To basically read the EHR data and automatically draft a discharge summary. It pulls out the key stuff, meds, appointments, warning signs, and organizes it into a much clearer, easier to understand format.
So it translates the doctor speak.
It generates a first draft,
Yeah.
which saves clinicians so much time. Think about Nurse Patel in the sources. Instead of spending like an hour writing it from scratch.
The AI does it in seconds.
Pretty much. A structured draft appears, Nurse Patel reviews it, tweaks it, personalizes it, and that frees her up to actually sit with the patient, answer questions, make sure they really get it before they walk out the door. Fewer errors, better communication. Big win.
Okay, predicting risk, simplifying instructions. What else can AI anticipate or help with once someone's actually home?
Well, the sources mention post-discharge needs prediction, like figuring out if someone might need home care or other social supports based on their history.
Ah, okay.
And a really big one is medication adherence support. It's incredibly common for people to struggle with remembering multiple meds, complex schedules once they're back home.
That seems like a perfect job for technology. Smart pill dispensers.
Exactly. AI-powered dispensers, reminder apps. But it gets smarter than just simple alarms. The AI can actually personalize the reminders based on the patient's own behavior patterns.
How does that work?
Like, maybe it learns you tend to forget your evening dose, so it sends an extra nudge then. For Mrs. Rodriguez, remember her?
Yeah.
A smart dispenser could be pre-programmed, send reminders to her phone, maybe also to her daughter Maria's phone. And if doses are still missed, it could even send an alert to the care team.
Wow, that's like an extra layer of oversight.
It is. That intelligent support can make a huge difference in people actually taking their meds correctly, preventing easily avoidable problems.
That feels very practical, very day-to-day. What about follow-up appointments? People miss those too, right?
Oh, absolutely. It's a major issue. Breaks that continuity of care.
Okay.
So, follow-up appointment optimization is another area. AI models can predict who's likely to be a no-show.
Based on what?
Things like their past appointment history, demographics, maybe how complex their condition is.
And if the AI flags someone as high risk for missing,
Then the system can step in proactively. Maybe send a stronger reminder text. Maybe trigger a call from a scheduler. Or, like with Mrs. Rodriguez again, if the AI predicts transport is the issue.
it prompts the clinic to offer a solution, like a rideshare.
Exactly. It's about identifying those specific barriers and actively trying to remove them before the appointment is missed, smoothing the path.
It really feels like it's connecting all these different dots. Okay, what about monitoring patients at home, especially those with chronic conditions? That feels like a big gap currently.
Huge gap. And that's where remote patient monitoring analytics comes in. This is really powerful.
How does it work? Wearables.
Yeah, patients with things like heart failure, diabetes, COPD, they might use wearables, smart scales, blood pressure cuffs, glucose monitors. That data streams constantly.
Okay, so the doctors see the numbers.
It's more than that. The data goes to an AI platform. And the key is the AI doesn't just show the data, it interprets it. It looks for trends, subtle changes, deviations from the patient's baseline.
Things a human might miss just glancing at numbers.
Potentially, yeah. Or things that signal a problem before the patient even feels sick enough to call. It's like an early warning system.
Give me an example.
Okay, think of Mrs. Khan, the diabetic patient from the sources. Her continuous glucose monitor data is flowing in. The AI spots a concerning upward trend over a few days. Maybe her meds need adjusting.
So the AI flags it.
Yes, it alerts her doctor or nurse practitioner. They can then reach out, maybe do a quick video call, adjust her insulin dose, potentially avoiding a serious high blood sugar event, an ER visit, or even a hospital stay.
That's huge. It empowers the patient too, right? Seeing their own data.
Definitely. More visibility, more
Yeah.
control, while also giving the clinical team that watchful eye.
And what about those everyday questions? You know, you get home, you're recovering, and suddenly you wonder, can I take this pain pill with food? Or is this much swelling normal?
Right. Those things always pop up. That's where virtual nursing assistants can help.
AI chatbots.
Sort of, yeah. AI-powered tools, usually in an app or a patient portal. They use NLP to understand and answer common post-discharge questions, like Mr. Patel asking about his pain meds.
And he gets an answer straight away.
Usually, for common questions, yes, instantly, which saves him calling the clinic, waiting on hold.
And frees up the human nurses.
Exactly, for the more complex stuff. And crucially, if the AI doesn't know the answer, or if the question suggests a serious problem, it's designed to escalate immediately to a human nurse or doctor.
So there's always that safety net.
Always. The sources even mention AI helping with medication side effect monitoring. It can scan patient messages or symptom logs, looking for mentions of drugs and potential side effects, then flagging them for the clinical team.
Wow. Okay, so pulling it all together, the benefits seem really clear. Fewer readmissions, patients feel more supported, clinicians are more efficient.
Patients feel more empowered in their own recovery, too. It really contributes to a system that feels more efficient, yes, but also more genuinely personalized and centered around the patient's needs after they leave the hospital, extending that care.
But building these systems, it's not simple, right? What does implementation actually look like?
Now, it's complex. The sources lay it out. You need to integrate data from lots of places, mainly the EHRs, often using standards like FHIR, that's FHIRR, which helps different systems talk to each other smoothly.
Like a common language for health data?
Sort of, yeah. Then you have to actually build and train the AI models for each specific job risk prediction. NLP for summaries, analyzing monitoring data.
And get it into the hands of doctors and patients.
Right. That means designing interfaces that are easy to use for both sides. Building APIs. Those are the connectors that let different software talk so the AI tools plug into existing hospital systems.
And you probably don't flip a switch overnight.
Definitely not. Usually a phased rollout. Maybe pilot programs for certain conditions or departments first. And, importantly, the sources note, you have to adapt it. Like, for implementation in India, you need to think about low-bandwidth internet, designing for mobile phones first, supporting different languages, cultural nuances, digital literacy levels.
So the tech has to fit the reality on the ground.
Absolutely. And you can't just launch it and forget it. The sources stress continuous monitoring and evaluation after it goes live, making sure the AI stays accurate, finding ways to improve it. It's an ongoing process.
Which makes sense. And whenever we talk about AI and health data, especially making predictions about people's health, we have to talk ethics.
We absolutely do. And the sources raise several critical points. Number one, data privacy and security, non-negotiable. Protecting patient information needs super robust technical safeguards and strict adherence to regulations like IPPay or GDPR.
Got it. What else?
Algorithmic bias. This is a big one. AI learns from data. If the historical data reflects existing biases in healthcare against certain races, genders, socioeconomic groups, the AI can learn and even amplify those biases.
Leading to unfair or worse outcomes for some people?
Exactly. So it's crucial to train these models on diverse data and actively look for and try to correct biases. It's an ongoing challenge.
Transparency is important too, I imagine.
Hugely. Transparency and explainability. Patients and doctors need to understand, at least generally, how AI is being used in their care. Even if the algorithm itself is a black box, the process and purpose should be clear.
And the role of the human.
That's maybe the most crucial point. Human oversight. The AI is a tool, a powerful one, yes, but it's there to augment human skills, to support clinicians and patients. It should never replace the clinical judgment of a trained healthcare professional.
The doctor, the nurse, they always have the final say.
Always. That has to be the foundation. Building that trust, ensuring safety, that's how we can responsibly use AI to make post-discharge care better.
It really feels like when done right, this can truly transform that whole experience of going home from the hospital.
I think so. By tackling risk prediction, making information clearer, helping with meds and appointments, enabling remote monitoring, providing that virtual support. It addresses so many of the weak points in the traditional system.
Reducing those preventable readmissions, making you feel less alone, more supported, it builds that stronger bridge we talked about.
Exactly. It helps ensure care continues effectively, leading to better health outcomes overall and hopefully a more sustainable healthcare system.
It really reinforces that idea you mentioned earlier, AI as a kind of vigilant guardian watching over you after you leave the hospital.
Extending the reach of care, absolutely.
So as we wrap up this deep dive, looking ahead to that future, with AI potentially playing this vigilant guardian role during our recovery at home, here's something to think about. How will that change the relationship between you, your personal health data, and your doctors and nurses after you've walked out those hospital doors?